Hi, my name is Stephanie and I work as a biomedical engineer trainee at GE HealthCare. When I was in school, I realized that I really enjoyed studying maths and science. I loved understanding how things worked, but I didn't exactly know what I wanted to do. Through a careers day at college, hearing people talk about women doing engineering jobs really caught my attention, as I hadn't considered it because I knew that engineering is known to be male dominated. I was curious and I wanted to know more. So I started looking into it when I was applying for university, and that's how I found biomedical engineering. It combined my love for science, technology, and helping people. So I gave it a go, and now here I am working with medical equipment that helps save lives every day. It's okay to not know now what you want to do, and it's even okay to change your mind. But I know that you'll find something along the way that you enjoy and that seems right for you, just like I did. Based on site in a hospital in London, which means I get to see firsthand how the equipment we look after is used to help patients. You'll find all kinds of machines in hospitals, from infusion pumps that give patients medicine safely, to ECG machines that check heart activity, to defibrillators that send electric shock to the heart to restore a normal heartbeat, to neonatal resuscitation equipment that keep tiny babies alive and breathing, and even anesthetic and ventilator machines that help people breathe during surgery. All of these machines need to be safe, accurate, and reliable, and that's where biomedical engineers come in. I like to explain it like this. Think about a car. When something goes wrong, you take it to a mechanic who understands how all of the parts work together. In the same way, we look after the hospital equipment. We test, repair, and make sure everything is working perfectly so nurses and doctors can focus on caring for the patients. Working in a hospital can be busy, but it's also really rewarding. You get to see how the work you do behind the scenes directly impacts people's lives, and that's one of the best feelings. Now I'm on my way to do something called preventative maintenance, or PM for short. Here you can see I'm on my way to a department. I'm going to the intensive care unit to do a preventive maintenance on a dialysis machine. This is one of the machines I work with quite often. It is designed for short-term use to help clean a patient's blood when their kidneys aren't working properly, especially when they're critically ill and need constant monitoring. Every medical device in the hospital has to be checked regularly, sometimes once a year or more or less often, depending on the type of equipment. The goal is to make sure everything is safe, working properly, and ready to use whenever clinical staff need it. When we do a PM, we first do a visual inspection to see if there's any damage or wear and tear. I'll follow a checklist, like you see here in the video. Each device has its own procedure and tests we need to complete. I'll make sure all the functions work correctly and check the electrical safety. I'll also change any parts that need replacing. For all of these steps, I'll use different tools like my screwdriver kit, pressure meter, multimeter, and electrical safety analyzer. It's a bit like giving the machine a full health checkup to make sure it's performing at its best, because just like patients, machines need care too. Here are some of the neonatal devices I work with. These are the machines that support newborn and premature babies. They are used in those first critical moments to help babies breathe and stay warm when they're first born. These are considered high-risk devices because they're used in life-saving situations, so it's really important that everything works accurately. What's interesting is that even though I work for GE Healthcare, we repair and maintain equipment from lots of different manufacturers in our hospital. So I get to learn about many types of machines and technologies. Every day I'm learning something new, and I love knowing that the work that we do helps nurses and doctors give the best possible care to patients, even the tiniest ones. When I was younger, I wasn't the most outspoken person. I was shy and would just get on with my work. But as I got older, I learned how important good communication is, especially speaking up and sharing your ideas. Even when I felt nervous, I got used to introducing myself, presenting my work in front of people, and putting myself out there. These experiences helped me gain confidence, and this is so important when applying to jobs, networking, and working in a hospital, where you talk to customers every day and help solve their problems with their medical devices. I used to be worried about asking the wrong questions or not always knowing everything, but now I like to ask questions and take initiative because I know that's how I'll learn and grow in my role. It shows I care about my work and I want to keep improving. Everyone starts somewhere, and the more you ask and get involved, the more confident you become in yourself and what you do.